This is a case of Crohn's disease who came with intestinal obstruction due to stricturing Crohn's. The patient is a young male with predominantly ileocolonic disease. The ileocecal region is affected, and you can see there are multiple strictures in the terminal ileum, the last part of the small intestine, and there is a stricture at the ileocecal junction. So this patient has severe abdominal pain and vomiting, and he came with frank obstruction. He was non-compliant with treatment. You can see the multiple strictures of the small bowel here. Some are critical and some are not so critical, and the critical stricture is at the ileocecal junction, and you can see the mesenteric fat stranding of the affected bowel, and the normal bowel doesn't have the mesenteric fat stranding. So Crohn's is essentially a medically managed disease. Surgery is reserved for patients who develop complications like this. Here you can see the ileocecal stricture causing a obstruction in this patient, and we are going to do a right hemicolectomy. So we have done a right hemicolectomy here, and the colon was relatively spared. The disease was confined to the cecum and the terminal ileum, and here the colon is apparently free from disease. Here the disease is localized to ileocecal region. Such patients do well with surgery. As there are multiple sequential strictures and a critical stricture at the ileocecal region, we are not doing stricturoplasty here, we are doing a right hemicolectomy. Whenever we are doing surgery for Crohn's disease, it's very imperative that we preserve as much bowel as possible. Try and avoid bowel resection. Try to conserve and preserve the bowel. Avoid extensive bowel resections because they will land up in short gut syndrome. Patients with Crohn's disease have to be under regular follow-up. They cannot skip medications, and it's always very important to have a regular follow-up to monitor the disease progression as well as the complications of treatment. We have been treating patients with Crohn's disease for over 2 decades now, and if you want to consult us, please call us on 98954 It is our humble request to patients not to stop treatment on their own and not to try alternative forms of treatment.